Hi, this is Justin with Rolling Now Health IQ. Here to talk to you more about chronic care issues that African Americans face in the community. I'm here with PhD candidate Rachel Robbins. How are you doing today?
Good. How are you doing?
I'm well. I'm well. Can you provide the community with a little bit of your background and what you're studying right now?
Yeah. So I'm based in New York City. I currently work as an assistant nurse manager at NYU Langone Health. I have a background as a midwife there as well that I worked at two years. And then I am doing my PhD in nursing research, focusing on postpartum depression among Black women, and just looking at if there's misdiagnosis, mistreatment in that area. And so that's kind of where I'm at right now.
So, what are some challenges that African American women face when trying to find or access quality prenatal and postpartum care?
I think the biggest is probably social determinants of health, insurance access and healthcare access. I think New York City does a really good job with access to care, but sometimes, like what we have, are health H&H hospitals that do take Medicare, Medicaid, and not all hospitals that have access to all the resources take those insurances. So I think that's kind of one of the biggest things. There is really good care in those H&H hospitals, but I think it's kind of a little push for Black women that need to advocate for themselves and have other people to advocate for them.
So when we talk about these resources, I mean, are there any resources and organizations that come to mind that Black mothers can seek that also make sure that they're culturally competent and effective?
Yeah, I mean, I think March of Dimes is really good. It gives like a kind of quick informational about certain things if you were to Google. There's the Black Mothers Matter Alliance that provides like across the country information, which is really nice. And then in New York City, there's Ancient Song and Mama Glow Doula Services. So they're both Black owned, and they're really passionate about Black maternal health. And they're really, a big part in Black maternal equity as well. And so I think kind of just seeing they offer doula services and seeing if that can be something that you use both in prenatal care and postpartum care.
So then what are some of the things that Black mothers can do to advocate for themselves in hospital settings to ensure that
I
they
think I
receive
would
that?
say like, oh, sorry, what'd you say?
No, no, go ahead.
I would say definitely advocate. I think one of the biggest things is having a birth plan. I do like to tell people that with birth, there are changes. So not to have something concrete, kind of be flexible. So I think that's one of the biggest things, and just have that plan and discuss with either your partner or your doula and your provider kind of what you're looking for before you even get to the hospital, because birth kind of has a whole bunch of emotions, and you really forget all the things that you kind of discussed prior to. So if you have those things already set in stone and have those people kind of there for you to advocate your needs, I think that really helps.
So switching gears, what are
Mhm.
some of the common pregnancy complications that disproportionately affect women of color, and how can they be
Um,
prevented or managed?
yeah, I mean, like with Black maternal mortality, it is the highest in the United States, even like higher than some developing countries in the world. So I would say preeclampsia, which is high blood pressure for women who are pregnant, gestational diabetes, preterm both, and then postpartum hemorrhage, which is kind of just a certain number that we hold in the hospital. Um, I would say those are kind of like the top causes for that, but there are certain things like I think in news outlets that post, there's someone who Serena Williams, for example, she kind of had an issue where she had to fight for herself, and that doesn't necessarily like I mentioned before, social determinants of health. Like Serena Williams has lots of money and has like access to the best resources. So I think like there is kind of like a structural racism issue as well that we need to address because that does sometimes get in the way of complications. And so I think just knowing about the top complications that Black women at are higher risk for again, that would help them advocate for themselves. They can look for the signs and symptoms of what that looks like. And so if they're in a situation where they're feeling something different, the main thing is to trust their body and bring their issues to their providers.
Right, that racism piece, I mean, it's important, and I'm glad you brought that up. So then, I guess switching gears now, what are some of the benefits of working with a midwife compared to like a traditional birth setting?
I so like midwives, which is really nice. They do birth and prenatal care in many settings. I think a lot of times people think about midwives and they kind of think about like lay midwives, which really held the foundation for midwifery care, especially in the Black community. That's kind of who started midwifery were Black women. And then it kind of just changed trajectory. And now, like, there's nursing midwives, there are certified midwives that don't have a nursing background. And so they all can have a different scope of practice. But I'm a nurse midwife. So I did nursing school for 4 years, and then I did another 4 years for my master's and certified to become a nurse midwife. And so I have the ability to see patients, prescribe medications, see patients by myself without having an authorized physician. And so a lot of people don't know that. And then, provide gynecological care as well, not only pregnancy and birth. But I think midwifery care kind of has that nursing background. It's very like holistic, and it looks at the patient as a whole. And I think that's a different approach to birth when a lot of times, on the medical side or OBGYN side, they're really looking at more of just the physical and not so much of the mental. And I think with pregnancy and birth, it kind of takes everything that you have to include in order to have a successful birth and whatever that looks like for that person. So I think that's kind of where midwives come in.
And so then, what are some, I guess questions or things that Black families should know when they're getting midwifery care
Mhm.
as it relates to maybe, if they're uninsured or underrepresented.
Yeah, I mean, I think midwives, they are really up front in what's going on with Black maternal health and healthcare. So I think like at least the midwives that I interact with in New York, like they all kind of know that this is an issue and are really working to um, battle that. I think if you're looking for care and uninsured, the good thing with pregnancy, I don't know about other states, but in New York, you do get health insurance even if you're uninsured. As soon as you become pregnant, you do have the access to get health insurance, and a couple of weeks after postpartum as well. So that is something that does take away the stress from a pregnant person. I think too, like with midwives, they do take like Medicaid, Medicare insurance. So if that is a worry of like, I don't know if my insurance will be taken, they do. And like some people are not, like they don't want to go to hospitals, and they want to do home births. And that is something as well that they do take Medicaid, Medicare insurance. They kind of work really hard to make sure that that person gets the best prenatal care and birth and postpartum care as possible.
Postpartum depression. Um,
Yeah,
as a man, I'm not aware of it, but I am aware of it.
right.
I'd like to focus on that. So, what are some essential postpartum resources for Black mothers, including mental health support and lactation consulting? Like, what are your thoughts on that?
Yeah, I mean, so a lot of midwives are lactation counselors. We do kind of get that certification. Like I have that certification because I kind of just want to make sure like I'm a one-stop shop for someone. And so there are, there's like La Leche League that helps mothers who want breastfeeding support. There's also usually in the hospitals, they do have someone that you can contact after postpartum, like postpartum. I think for postpartum depression, it is a little difficult, especially when it comes to Black women, which is kind of what really fueled my research that I wanted to do. Because a lot of times, like the strong Black woman, that persona and framework kind of affects the way that Black women present in postpartum depression. And so I think like being comfortable in sharing what's going on, it may not necessarily look like what the provider is telling them, whether they're saying, oh, like, are you feeling sad? Are you feeling tearful? Are you not able to go to work? I think like for Black women, they they do need to go to work a lot of the times and they don't really have an option. And so they kind of just push forward and they're like, I can't do that. I'll do it later. So I think kind of just expressing all of those and not so much worrying about if, if there's a problem with social work or anything like that. I think that's kind of a big fear that I see. And so just being open with the providers or, seeking out mental health support is really important. And I mean, you did mention something good, like being a man, postpartum depression, but postpartum depression also does affect male partners as well. Yeah. Yeah. So I think
Um,
like that, yeah, that is something to take into consideration. So it's you also are supporting someone that's going through a mental health crisis. So I think that's also important to let the partners know, like you should also reach out for resources as well to make sure you're supported as well.
so when we think about then culturally specific childbirth education classes and resources, I mean, we talked about some other ones earlier, but do you have
Yeah.
any childbirth education classes that you recommend for Black families?
I mean, the ancient song Mama Glow, like those both offer childbirth education classes. And I think a lot of like Black owned doula companies do offer childbirth education. I think it's really important to just take a childbirth education class as first time parents. There's a lot of things that people are like, oh, I'll just see it in a prenatal visit, but prenatal visits are so fast that you
Right.
can't really ask that many questions. And so I think a lot of times people are like skip that part and kind of, I think that's really important. There's books that are out there as well, just to kind of like know what questions to ask. Like you don't need to know everything, but like if you see it, you're like, okay, let me like put that in my back pocket, take a note on my phone, so then I can ask my provider about these questions. So you're not kind of totally in the dark once it's time to give birth.
Rachel, thank you so much for your time. I really
Yeah, of
appreciate the
course.
insights. I know the community does as well. We look forward to speaking with you on more topics in the future. All right.
All right. Thank you so much.
Thank you.